Hi friends, hello, very good morning to one and all. Welcome to our channel, The Voice of Nurse. Today we are going to discuss continuous topic from the previous videos, child health nursing point of view. Part 3 friends, already we finished part 1 and part 2. This is part 3 from the continuous from the previous videos. In part 1 we discussed related to the child health nursing. Introduction about child health nursing, growth and development, sick child, disorders and health problems of a sick child and child with or children with various disorders and diseases, and how to identify a sick child and the common health problems and disorders of health problems in child, common health problems in children's. These all are things we already covered in part 1 plus along with these topics 20 questions we already discussed in part 1. Next in part 2 video we continuously discuss related to the FAQs, very important questions, 30 to 50 questions. 30 questions we discussed in part 2. Now we are going to discuss part 3. In part 3 we will discuss from the question number 51 to continuous 51 to further question we will discuss in this video. Before moving on to topic, a small request friends. Anybody watching first time my channel, please subscribe my channel, click on the bell icon for further notification and like the video and share the video to your friends. Please drop your opinion in comment section. Let's move on to topic discussion. Today we are going to discuss part 3 child health nursing 51 to continuous question we are going to discuss. The 51st question is, in spina bifida cystica, child is placed in following position. The child is having spina bifida cystica. In the child having spina bifida cystica, which position we will suggest for the patient? We will see here options. Option A, supine position. Option B, semi-erect position. Option C, head down position. Option D, prone position. Here what is spina bifida cystica? We have to know first. Spina bifida cystica are split spine. Spina bifida cystica is also called as split spine, a birth defect in which a developing baby's spinal cord fails to develop properly while in the womb itself. It is a type of neural tube defect. So spina bifida is a neural tube defect, type of neural tube defect, and in the womb itself the spina bifida cystica will develops in the womb itself. Best sleeping position to reduce pain and the recommended position for the child either on prone position is often used for the client or child with spina bifida cystica. The prone position produces an increase in functional residual capacity and alterations in the distribution throughout the lungs. So here the spina bifida cystica child we have to provide a position, prone position. So here option D is the correct answer. Not only prone position, we can provide some cases in silent position also. So here option D is the correct answer. Next we will move on to question number 52. The word ESSR means in feeding, means in breastfeeding. ESSR means, we will see here options. Option A, enlarged nipple, sleep, swallow, rest. Option B, enlarged nipple, suck, swallow and reverse. Option C, enlarged nipple, suck, swallow and rest. Option D, none of the above. ESSR is a effective technique. ESSR is a effective technique developed for the breastfeeding method. Feeding will not be easy for the post-op cases. Some of the cleft lip, cleft palate cases, surgery, post-op surgery, this method can be used for these cases. Here ESSR means enlarge of the hole, stimulate, suck, insert, then invert bottle and swallow and rest. So here option C is the correct answer. Breast milk helps the body fight off sickness and diseases. Through breast milk can reduces diarrhea, ear infections, lung infections and SIDS. So ESSR means here option C is the correct answer. Enlarged nipple, suck, swallow, rest. Next we will move on to question number 53. The common endocrine metabolic disease of childhood is. In childhood, common endocrine metabolic diseases from the following. Option A gout, option B Cushing syndrome, option C diabetes, option D all of the above. Here option A gout. Gout is a common and complex form of arthritis. So gout means arthritis, common form of arthritis. So here endocrine metabolic disease in children means gout will not come. Next, what is Cushing syndrome? Cushing syndrome is also called as hypercortisolism, a condition that occurs from exposure to high cortisol levels for a long time. So here option B is also not comes. Option D is all of the above is there. So here option C is the correct answer, diabetes. Some metabolic disorders develop during a person's life. Pediatric metabolic disorders happen when the child's body is not appropriately processing nutrients such as fat, proteins or sugars. Most common metabolic disorders in child is diabetes mellitus. So here in this option, the common endocrine metabolic disease of childhood is option C, diabetes is the correct answer here. Next we will move on to question number 54. From the following, which shunt drain of CSF from ventricles to peritoneal cavity? Here from the options, from the following, which shunt drain of cerebrospinal fluid from the ventricles to peritoneal cavity? We will see here options. Option A, ventriculopulmonary shunt. Option B, ventriculoperitoneal cavity. Option C, arterioventricular shunt. Option D, arteriopulmonary shunt. The procedure is done in the operating room under general anesthesia. It takes about 1.5 hour, means 1.5 hour. Totally 1.5 hour it will take a time. A tube catheter is passed from the cavities of the head to the abdomen to drain the excess cerebrospinal fluid. So here option B is the correct answer here. A ventriculoperitoneal cavity VP shunt is a surgical treatment for hydrocephalus. Hydrocephalus is a neurological disease, literally meaning water on the brain, and can be very disabling. So here ventricular peritoneal cavity is the correct answer. There are the two types of the shunt valves, fixed and adjustable for the procedure. Here we are having fixed and adjustable types of the surgical procedure. In this question, the shunt drain of cerebrospinal fluid from the ventricles to peritoneal cavity is ventriculoperitoneal cavity. Option B is the correct answer here. Next we will move on to question number 55. A Wilms tumor is most commonly metastasized to the which organ? So here Wilms tumor is most commonly metastasized in the which organ of the body? We will see here options. Option A brain, option B vertebrae, option C lungs, option D liver. Here Wilms tumor is also called as nephroblastoma. So here name itself is there, nephroblastoma. Nephro means it is a kidney. So here Wilms tumor is present in the kidneys. Wilms tumor is a type of childhood cancer that starts in the kidneys. Wilms tumors is the most common type of kidney cancer in children. About 9 of 10 kidney cancers in the children. So in the children's kidney cancer, they are affecting in every 10 children's 9 children are affecting with the kidney cancer due to the Wilms tumor. In children's, Wilms tumor cancer starts when cells in the body begin to grow out of control. So here Wilms tumor most commonly metastasized to the lungs. Pulmonary metastasis with 80% having most common in lungs. First lungs than liver, bones and brain or lymph nodes outside of the abdomen. So here Wilms tumor most commonly metastasized in option C, lungs is the correct answer. Next we will move on to question number 56. A 3 months old infant can do all of the following except. Here infant means up to 28 days. But here in previous questions, previous exams, we got like this only question. Don't confuse friends. In 3 months old infant means 3 months old baby itself, not infant. We will see clearly in this question. A 3 months old infant can do all of the following except. The 3 months old child can do from the all of the following except means these all are the milestones. We will see option A fail to grasp, option B listen to music, option C creep crawl, option D social contact. What are the milestones will happen till the 3 months we will see. In 3 months of milestones will be raises head and chest, tummy and supports upper body with arms, open and shuts hands means opens and closes the hands, brings hand to mouth, being to develop a social smile, enjoys playing with others and listening music. So here we got a listening music and social contact. Sustaining social contact also is there in the 3 months old child. Fail to grasp is not there. So here 3 months old child is having no do develop a creep and crawl. So here option C is the except here. What is creep and crawl we will see. The creep and crawl means move slowly in the case of people or animals with the body near the ground. So 3 months baby can't move from the place to another place with a sounds. They will not move. So here creep and crawl is the except 3 months old milestones. Next we will move on to question number 57. Klumpke's palsy is a damage of which nerves? So Klumpke's palsy is damage of which nerve? We will see here options. Option A third or fourth cervical nerve. This is not cranial nerve, cervical nerve. Option B 7th or 8th cervical nerve. Option C 4th and 8th cervical nerve. Option D none of the above. Klumpke palsy occurs from damage to the nerves in the brachial plexus, which is a collection of nerves that runs from the spinal cord through the armpit, carrying signals to the hands, arm and shoulders. Usually the 8th cervical nerve and first thoracic nerves are injured in this Klumpke palsy. So here option B 7th or 8th cervical nerve is the correct answer. Klumpke palsy is the damage of 7th or 8th cervical nerves. Next we will move on to question number 58. Cannula size used in neonates. In neonates, which cannula size we will use in rare hospitals? Options. Option A 24 gauge, option B 20 gauge, option C 22 gauge, option D 18 gauge. Peripheral cannulation is a common invasive procedure carried out within the neonatal unit. Peripheral cannulation is indicated for administration of fluids and medication to the neonates. The best IV catheter size for the neonates, most babies in the short 24 gauge catheter. Some cases can use 24 gauge in little babies. So here cannula size is used in the neonates is option A 24 gauge is the correct answer. Yellow and purple are commonly used cannulas in pediatrics. Next we will move on to question number 59. What should be the initial bolus of crystalloid fluid replacement for a pediatric client in a shock? What is the initial bolus for the crystalloid fluid replacement for the pediatric client? The pediatric client is in shock. We will see here options. Option A 20 ml for kg body weight. Option B 20 ml for kg body weight. Option C 30 ml for kg body weight. Option D 50 ml for kg body weight. The serving sepsis companion recommends fluid bolus of 10 to 20 ml for kg of ideal body weight, up to 40 to 60 ml for kg. Over the first hour of management in pediatric sepsis, we can give a bolus for the 20 ml. Current recommendation are to administer medicines. Crystalloid fluid replacement is 20 ml for kg of fluid as bolus over 5 to 10 minutes of the time. Then if it is needed means we can repeat as needed. What is crystalloid fluid? Crystalloid fluid is an aqueous solution of minerals, salts and water soluble molecules. Patient should receive a fluid challenge of 20 ml per kg over the first 30 minutes of treatment. Subsequent volume dosing should depend on the severity of hypovolemia and should be adjusted in increments of 500 ml, aiming for a ultimate central venous pressure of 8 to 12 mm of Hg. What is the example of a crystalloid fluid? The frequently used crystalloid fluid is sodium chloride 0.9%, more commonly known as normal saline 0.9%. So here option B 20 ml for kg body weight, we have to give a crystalloid fluid initial bolus for the fluid replacement in the shock pediatric childs. Next we will move on to question number 60. In children, which disease occurs due to protein deficiency? In children's, which of the disease means the disease due to the protein deficiency? We will see here options. Option A beriberi, option B marasmus, option C kwashiorkor, option D scurvy. We will see one by one. Beriberi. Beriberi is also called as thiamine deficiency, a disease in which the body does not have enough vitamin B1 or thiamine is due to the deficiency of thiamine. So here option A beriberi is not protein deficiency disorder. Next option B marasmus. What is marasmus? Marasmus occurs as a result of total calorie insufficiency. This leads to overt loss of adipose tissues and muscles. Marasmus also one of the protein energy malnutrition but occurs as a result of total caloric insufficiency. Next we will see option C kwashiorkor. Kwashiorkor is also called as protein malnutrition. Malnutrition produced by a severely inadequate amount of protein in the diet. Kwashiorkor is a type of malnutrition characterized by severe protein deficiency. So here in this question, in children, which disease occurs due to the protein deficiency means option C kwashiorkor is the correct answer. The scurvy is due to the severe lack of vitamin C in the diet. So the vitamin C deficiency is scurvy. Here kwashiorkor is the correct answer. The early signs and symptoms for the kwashiorkor is fatigue, irritability and lethargy, growth failure, loss of muscle mass and edema, decreased immunity. So here option C kwashiorkor is the correct answer. Next we will move on to question number 61. What is the wangensteen rice X-ray will diagnose? The wangensteen rice X-ray will diagnose from the options. Option A pyloric stenosis, option B anorectal malformation, option C esophageal atresia, option D all of the above. What is wangensteen rice X-ray? We will see now. The wangensteen rice X-ray first described the use of inversion radiography in 1930 to indicate the distance between the gas bubble within the terminal colon and the perineal skin. So here option B anorectal malformation is the correct answer. The wangensteen rice X-ray will diagnose the imperforate anus. So here anorectal malformation is the correct answer, option B. Next we will move on to question number 62. A child with leukemia is being discharged after chemotherapy. The nurse should teach the parents about. Here the child is having leukemia, being discharged after the chemotherapy. So here the nurse should teach the parents about. We will see here options. First option A, low protein and high carbohydrates. Option B, monitor temperature second hourly. Option C, avoid fresh vegetables, means non-cooked. Option D, all of the above. What is leukemia? Leukemia is cancer of blood forming tissues including bone marrow. The signs and symptoms of leukemia is fever or chills, persistent fatigue, weakness, severe infection, generalized weakness. These all are the signs and symptoms of the leukemia. The nurse should teach the parents about fresh fruits and vegetables harbor microorganisms which can cause infection in immune compromised child. Fruits and vegetables should either be peeled or cooked. The physician should be notified of temperature above 100 degree Fahrenheit. A diet low in protein is not indicated, and humidifiers harbors fungi in the water contains. So we have to take care of about this. So the nurse should teach the parents for the leukemia child post chemotherapy, after the chemotherapy. Here avoid fresh vegetables, non-cooked vegetable to be avoided here. Next we will move on to question number 63. Height of neonate will doubles by. We will see here options. Option A 3 years, option B 5 years, option C 1 year, option D 2 years. The child from the birth to about age of 6 months babies tend to grow about 1 inch a month. For month they will grow a height 1 inch. From 7 to 12 months, a baby might grow about half an inch for the each month. Height will be about double the height at the age of 5 years. So here the height of neonates will be doubles by option B is the correct answer, 5 years. In some books we are having the height of neonates will doubles by age of 4 years itself. But here we are having option B 5 years. In some books is also is there 5 years the height of neonate will doubles. Next we will move on to question number 64. Which immunity presents in breast milk? Which immunity is present in breast milk? We will see here options. First option A, active natural immunity. Option B, active artificial immunity. Option C, passive natural immunity. Option D, all of the above. Breast milk also contains antibodies, which means that babies who are breastfed have passive immunity for longer. The thick yellowish milk is called as colostrum. Produced for the first few days following the birth is particularly rich in antibodies. So here the which immunity present in breast milk is option C, passive natural immunity is the correct answer here. Next we will move on to question number 65. A child diagnosed as SARS. Based on the mode of SARS transmission, which PPE should the nurse have to wear? So here the child is diagnosed as SARS, SARS. SARS means severe acute respiratory syndrome. The mode of SARS transmission, which PPE should be nurse have to wear? Option A, gloves, goggles. Option B, gown, gloves and mask. Option C, gloves and gown. Option D, gloves, gown, mask and eye shield or goggles. The severe acute respiratory syndrome is also called as SARS. Whether the SARS and COVID is the same, we will see now. COVID-19 is the clinical syndrome associated with the SARS-CoV-2 infection. It is characterized by a respiratory syndrome with a variable degree of severity in illness. Mean this time we have to, or the nurse have to protect herself or himself through the personal protective equipments. Why? Because of the SARS, severe acute respiratory syndrome. In name itself is the respiratory syndrome. It is a airborne disease. Restrict susceptible employees from the entering to the room. Use personal protective equipments including gloves, gown and eye protection, and practice hand hygiene. Face mask. Wear a fit tested N95 or higher respiratory mask. Remove all PPE before leaving the room except for the respiratory mask. Here option D, gloves, gown, mask, eye shield or goggles is the correct answer. Child is having SARS, diagnosed as SARS, and based on the mode of transmission, the PPE should be nurse have to wear is option D is the correct answer. Gloves, gown, mask, eye shield or goggles is the correct answer here. Next we will move on to question number 66. Physiological jaundice mainly occurs due to, we will see here options. Option A, hemolytic disease. Option B, liver immaturity. Option C, diabetes. Option D, viral hepatitis. Most newborns have some yellowing of the skin or jaundice is called as physiological jaundice. A newborn's immature liver after cannot remove bilirubin quickly enough, causing an excess of bilirubin typically appears on the second and third day of the life in the newborn baby. So here physiological jaundice mainly occurs due to the liver immaturity. So here option B is the correct answer. What are the causes of jaundice in newborns? A blood infection means sepsis, a different blood type than mother and father, breathing from a difficult birth, too many red blood cells, a low oxygen levels means hypoxia, a liver condition such as biliary atresia. These all are the causes of the jaundice in newborns. The physiological jaundice mainly occurs due to the liver immaturity. Here option B is the correct answer. Next we will move on to question number 67. What is the silent killer of the newborns? What is the silent killer of the newborns? Options. Option A, neonatal hypothermia. Option B, neonatal jaundice. Option C, neonatal hypoglycemia. Option D, all of the above. A newborn or child silent killer disease is hypothermia. In adults, a silent killer disease is hypertension. So here the newborns or children's, the silent killer disease is neonatal hypothermia, but in case of adults the silent killer disease is hypertension. When the body is having hypothermia, then do not see the shivering condition in the baby, because at the time baby's central nervous system is immature, then shivering is absent. So here the silent killer of the newborn is neonatal hypothermia. Option A is the correct answer. Next we will move on to question number 68. Baby secretes milk from breast is called as. Baby secretes the milk from the baby's breast, not mother's breast. Here baby secretes milk from the breast is called as. Option A, first milk. Option B, milk secretions. Option C, which is milk. Option D, extra milk. The neonatal milk secretion is considered a normal physiological occurrence and no treatment or no testing is necessary. Which is milk or neonatal milk is secreted from the breast of some newborn human body or humans in infants or either sex, means it will be male or female, either sex. The secretion of milk from the baby's breast, it can be unisex, means it can be either female or male. Witch's milk is an uncommon condition goes away within 2 weeks. No need of worry about this. This is normal condition only. So here the baby secretes milk from the breast is called as witch's milk. Next we will move on to question number 69. Moro reflex is also called as. We will see here options. Option A, tonic neck. Option B, stactyl reflex. Option C, glabellar reflex. Option D, none of the above. The Moro reflex is also called as stactyl reflex. That's because it usually occurs when a baby is startled by a loud sound or movement. In response to the sound, the baby throws back her head, extends out her arms and legs, creases and pulls the arms and legs back in. So here the stactyl reflex is also called as Moro reflex. Moro reflex means usually occurs when a baby is startled by a loud sound or movements. So here option B, Moro reflex is also called as stactyl reflex. Next we will move on to question number 70. What causes the infection of umbilicus? So what is the causes for the infection of umbilicus? We will see here options. Option A, tetanus. Option B, ophthalitis. Option C, erythema toxicum. Option D, viral infection. The causes infection of umbilicus is ophthalitis. Option B is the correct answer. Ophthalitis is an infection of the umbilicus and or surrounding tissues occurring primarily in the neonatal period. It is limited to around the umbilicus in the majority of newborns. However, it can rapidly progress to the systemic infection and death, with an estimated mortality rate between the 7 to 15%. A combination of parenterally administered anti-staphylococcal penicillin and an aminoglycoside antibiotic is recommended for the uncomplicated ophthalitis. Intravenous antimicrobial therapy with clindamycin or metronidazole may be indicated in to the umbilicus infection. So here ophthalitis, option B is the correct answer. The causes infection of the umbilicus is ophthalitis. So here option B is the correct answer. Next we will move on to question number 71. Low set ears indicates to. The low set ears are indicates to which of the conditions? Option A, decreased ICP. Option B, mental retardation. Option C, congenital malformation. Option D, Down syndrome. The low set ears indicates to may occur with a number of genetic syndromes, and children often have developmental delays. Ears are considered low set if the top of the ear is below the outer corners of the eyes and other birth defects. What is low set ears? Low set ears means clinically if the point at which is helix of outer ear meets the cranium is at or below the line connecting the inner canthus of eyes, the ears are called or considered as low set ears. So low set ears associated with conditions such as Down syndrome and Turner syndrome. So here the low set ears is indicates to Down syndrome, extremely rare syndrome involving here. So here low set ears is indicated to Down syndrome. Next we will move on to question number 72. What is the normal birth weight in a newborns? What is the normal birth weight? We will see here options. Option A, 2 kg. Option B, 3 kg. Option C, 2.5 to 2.9 kg. Option D, 3 to 3.5 kg. The average Indian newborn usually weighs between the 2.5 to 2.9 kg. Birth weight is a strong indicator for the mother's health and nutritional status, and also the chances of survival of the newborn and long-term health and development of the child. So here the normal weight of the newborn is option C 2.5 to 2.9 kgs is the correct answer here. Next we will move on to question number 73. Cold chain is used for. The cold chain is used for. Options: option A, treatment for pyrexia. Option B, maintain room temperature. Option C, storage of vaccines. Option D, all of the above. What is cold chain? Cold chain is common temperature range is 2 to 8 degree Celsius. Depending upon the medicines, the temperature will change. Here we are having cold chains, two types of the cold chain, active cold chain and passive cold chain. The cold chain is a set of rules and procedures that ensure the proper storage and distribution of vaccines to the health service from the national to local level. The local level, the cold chain is interconnected with refrigeration equipment that allows vaccines to be stored at recommended temperatures to maintain their potency. Here, what are the examples for the cold chain products are includes here: pharmaceuticals, vaccines, biologics, lab samples, diagnostic materials, chemicals, food and beverages. So here the cold chain is used for storage of vaccines. Option C is the correct answer. Next we will move on to question number 74. For an infant daily requirement of vitamin C. So infant daily requirement for the vitamin C, how much? We will see here options. Option A, 10 to 20 mg. Option B, 40 to 50 mg. Option C, 25 to 30 mg. Option D, 50 to 70 mg. How much vitamin C is needed for the according to the age wise, we will see now. In infants 0 to 6 months, 40 mg they need a vitamin C. In infants 7 to 12 months, child have to receive vitamin C 50 mg. Next, children's 1 to 3 years, they have to receive a 15 mg. 4 to 8 years children have to receive a 25 mg. Vitamin C is the more benefits of for a told us. Vitamin C is a wonder nutrient that plays a role in many of body's systems. So here infants daily requirements of vitamin C. Babies require 40 to 50 mg of vitamin C per day depending on their age. So here option B is the correct answer, 40 to 50 mg. So here option B is the correct answer. Next we will move on to question number 75. The first dose of Penta 5 vaccine is given at. We will see here options. Option A, 9 months. Option B, 15 months. Option C, at birth. Option D, 6 weeks. First dose is given as pentavalent vaccine only after a child is 6 weeks old. The second and third doses are given at 10 and 14 weeks of age respectively. So here the first dose of Penta 5 vaccine is given at the age of 6 weeks. As per the National Immunization Schedule, 3 doses of pentavalent vaccine are to be administered at the age of 6 weeks, 10 weeks and 14 weeks of age. Every dose means if we are giving pentavalent vaccine to the child means each and every dose between we have to maintain 4 weeks of the gap. So here administer at 6 weeks and 10 weeks and 14 weeks. Here the first dose of Penta 5 vaccine is option D, 6 weeks is the correct answer here. Next we will move on to question number 76. 3 days old neonate is brought to immunization clinic and the neonate not received any vaccines yet. So here the 3 days old neonate we received in the immunization clinic. Neonate not received yet any vaccine at birth. From the following, which vaccine now should be administered? Here we will see the options first. Option A, BCG, Bacillus calmette guerin. BCG means this one. Next OPV. OPV, option B, OPV means oral polio vaccines. Option C, hepatitis B. Next option D, all of the above. The first vaccine given to a baby after the birth is BCG, OPV and hepatitis B. So here all of the above is the correct answer. Baby first vaccine hepatitis B is the first vaccine most babies receive and it is given within 24 hours of birth. The second hepatitis B vaccine when they are 1 month to 2 months old. The third dose we can give at the age of 6 months to 18 months old. So here 3 days old neonate is brought to immunization clinic, not yet receive any vaccines. The nurse had to provide BCG, OPV, hepatitis B. All of the above is the correct answer. Next we will move on to question number 77. In which of the following disease has been eradicated from world? So here we are having 4 diseases. In from the 4 diseases, one is eradicated from the world. So options: option A chickenpox, option B whooping cough, option C smallpox, option D measles. In 1980, WHO declared smallpox eradicated, the only infectious disease to achieve this distinction. This remains among the most notable and profound public health success in history. So here from the options, disease has been eradicated from the world is smallpox. Option C is the correct answer here. Additionally, I want to mention one more thing. Which disease eradicated by India? If we are getting this question in exams means which disease is eradicated by India means diseases like plague, leprosy and smallpox have been completely eradicated from the India. But in world level, eradicated disease is smallpox, but in India is plague, leprosy and smallpox. Next we will move on to question number 78. Which of the following are parasomniac disorders except? We will see here options. Option A sleepwalking, option B nightmare, option C sleep terror, option D narcolepsy. Here what is parasomniac disorder we have to know. Parasomnia disorder or parasomic disorders. A parasomnia is a sleep disorder that involves unusual and undesirable physical events. It can occur during or before the sleep. If anyone have abnormal movements, talk, express emotions or do unusual things is called as narcolepsy. So here the parasomnic disorders means except here narcolepsy is the correct answer here. Narcolepsy is also called as excessive uncontrollable daytime sleepiness. The causes of narcolepsy isn't well understood but may involve genetic factors and abnormal signaling in the brain. Here option D is the correct answer, narcolepsy. Next we will move on to question number 79. Here the 24 years old lady delivered a premature baby. Which of the following medicine is useful for the newborn? Here the baby is premature baby and which medicine we have to administer for the newborn? Options: option A vitamin D, option B pantidine, option C dexamethasone, option D oxytocin. Here what is premature baby? We have to know. Premature baby is a birth that occurs before the 37 weeks of pregnancy is called as premature baby. In this condition, in this situation, the premature baby, we have to administer a dexamethasone. Dexamethasone accelerates maturation of fetal lungs, decreases number of neonates with respiratory distress syndrome and improve survival in preterm delivered neonates. Optimal gestational age for the use of dexamethasone therapy is 31 to 34 weeks of gestational age. Dexamethasone helps to relieve swelling, redness, itching and allergic reactions. So here the dexamethasone is the correct answer. What is dexamethasone? Dexamethasone is a corticosteroid. It works on the immune system of the newborns. So here the following medicine useful for the newborn preterm baby is dexamethasone. Option C is the correct answer. Next we will move on to question number 80. This is the last question in this video. Breast milk contains lysozyme content which protects, means the breast milk contains lysosome and content which protects. We will see here options. Option A, agonist infection. Option B, increases risk of infection. Option C, decreases spacing. Option D, all of the above. The benefits of lysoenzyme present in breast milk to improve the immunity and prevent infection in infants are gaining attention. This type of immunity is also called as passive immunity. So here the breast milk contains lysosomes content which protects against the infection. So here option A is the correct answer. What is the main component found in breast milk? Means human milk composition. Breast milk is the best food for the newborn babies. Human milk consists of 87% of water and 1% of protein, 4% of lipids and 7% of carbohydrates. Immunoglobulin G antibodies in breast milk help shape infants' gut bacteria and immunity. Researchers have known for some time that maternal breast milk provides critical nutrients for the newborns. So here breast milk contains lysosomes to protect against the infections. So here option A is the correct answer. This is the last question in this video. From the 81 to 100 questions, 20 questions. We will continue discussion in the next video, part 4. This is part 3. Till now we finished part 1 introduction and 20 questions, part 2 30 questions and part 3 30 questions. Till now we completed 80 questions in the child health nursing point of view. Thank you so much for watching my video, The Voice of Nurse, and please subscribe my channel, click on the bell icon for further notification. Please give a like and please share your opinion in comment section. Stay tuned friends.